Hi, Dr. Minkoff.
Hi, Michelle.
Lyme disease is almost at epidemic proportions now. Can you tell us how you go about diagnosing someone with Lyme disease?
Well, oftentimes Lyme disease isn't a traditional picture. You know, the person was walking in the barn, they got a tick bite, they got a bullseye rash, and then they had fever and chills and didn't feel well. Never see that kind of case. The cases we see are usually people who come in with rheumatoid arthritis as the diagnosis, or some chronic neurological disease, or some chronic fatigue type or autoimmune disease. Those are the usual presentations. So I screen for Lyme disease on every patient that I see, and I do it in a number of ways. If they've never been if it's never been considered before, I raise the issue with them. Is it possible that they had something, when did this thing start, and could they have been bitten by a tick? Or what I think is even more relevant is probably any arthropod that bites could transmit the disease. So it could be a mosquito, it could be something else like that. Then I do a very careful physical exam because I'm looking for signs that there may be Lyme disease apparent. And part of that physical exam is a very detailed neurological biofeedback exam. We call it autonomic reflex testing. And on autonomic reflex testing, we are able to screen the body for about a half a dozen Lyme organisms. And probably 90 to 95% of the time, when that reflex is positive for one or more of those Lyme organisms, when we do a confirming blood test, we get it. So I'm always looking for it in patients who have any kind of symptoms. And the other thing we do is that we look at their blood with a microscope to see are there spirochetes present, which are the organisms that cause this, in the blood. I have a specialty in infectious disease, and I used to sit with Dr. Abe Browdy, who is one of the most eminent infectious disease doctors in the world at University of California in San Diego, and each day we would look at microscopic slides of patients that were in the hospital, and we would see Lyme disease occasionally, or spirochete disease, Rocky Mountain spotted fever, things like this. So I learned how to do that, and I'm able to do that in my clinic now so that we can look at people's blood and also get an idea of, is Lyme there, or could it be there, or should we pursue it further with more diagnostics? The other part of the laboratory diagnosis that's a problem is that the usual screening tests done by regular laboratories are often not detailed enough. And there are some specialty labs which do much more detailed screening for Lyme or Lyme-like organisms where we can actually get a good diagnosis. So that's how we do it.
Okay, thank you.